Hello everybody. Following the previous video about how to write a standard medical article and the first video of this series that I talked about how to write a standard introduction for your original article, this video is devoted to general considerations for writing the method section of your original or research article. And in this video, I will follow the recommendation by the International Committee of Medical Journal Editors, as I mentioned in previous video, and the IMRAD format, which is the abbreviation for the introduction, method, result, and discussion. So we will talk about the method section, and the method section of your article is the place that you have to say what you exactly did to answer your research question. So in the introduction of your article, you explained to the reader why you did your study. In the method section, you have to report what exactly you did to answer the research question that you mentioned in the introduction, or to answer the objective or aim of your study that you mentioned in the introduction. Method section of your article is actually the most important section of your article, because when you are designing your study and you think about the methodology of your research, if you make a mistake in performing specific requirements for different types of study designs, and you may not be able to get back and correct those mistakes. Unlike the other sections of your article, for example, if you made a mistake in the introduction of your article, it is possible that you get back and correct that. If you make a mistake in writing the results section of your article, data is yours. You can do another analysis, you can prepare other tables or figures, and you can rewrite the results section. Or if you make a mistake in writing the discussion of your article, there are many other literature available. You can refer to them, find new articles for argument and counter argument with what you already found and reported in the results section. However, if you had to or if you chose a study design which mandated you to randomize the patients to different groups, and you did not do that, you cannot get back and correct that while you are writing your method section. Or when if you had to make the participants of your study masked or blind, and you didn't do that, you cannot get back and correct that. So that's why the method section is the most important section of your article. It's actually the infrastructure of your research, and you should be very careful um, about how you design your study and how the method section of your study, and finally the method section that you are going to write about, is very important. On the other hand, method section is the easiest part of your article to write about. And the reason is that you just need to remember what you exactly did. So unlike other sections of the article, method section is the easiest part. You can just need to sit and write about what exactly you did. One important thing about writing your method section is that as you have to say what you did, every tenses that you need to use while you're writing your method section is the past tense in English language. So you did this, you did that. So always you are using past tense in English language. The way that you are writing the method section of your article is recommended to be like a recipe. This means that you need to write the method section in full detail about everything that you did in your study, in a way that if another researcher similar to you in any other parts of the world wants to repeat your work, they can use your method section, and just by reading the method section of your article, they should be able to repeat the work exactly as you did. So you need to write everything with full detail. You need to write about the setting of the study. You need to write about the design of your study. You need to write about the period of your study, how you calculated the sample size for your study. You need to define clearly how you selected your patients or you excluded some participants from your study. What was the characteristics of the patients and subjects, and what was the criteria for including those patients and subjects to the study. So uh, this is similar to what our team had published earlier in this study about the effect of preoperative statins on postoperative mortality, renal and neurological complications in patients undergoing cardiac surgery. We talked about the design of the study, which was a retrospective cohort study. We talked about the setting of study, which was two large hospitals in southern Iran, and the period of study, which was during 2008 to 2019. We also wrote about the inclusion and exclusion criteria, and you can see here that we included patients who had coronary artery bypass graft surgery or valve surgery during a 12-year period, and we excluded patients who already had one of the complications before their scheduled cardiac surgery. Method section of your study is the place that you need to talk about ethical issues related to your study. So, as you know, many studies that are done on human beings need a research ethics board approval. So if your study is among those studies that needs REB approval, you need to write about REB approval and exactly mention which REB approved your study to be done. And even if you exempt from REB approval, if your study is exempt from your REB approval, you need to write about that in the method section of your article. Informed consent is very important, and I have devoted another single video just talking about informed consent. So if you need to obtain informed consent from your patients or participants, the method section is the place that you need to talk about informed consent. While you're writing your method section, sometimes you need to describe a standard method for which there are other valid references. If you are using these standard methods, you don't need to describe all details of these standard methods in your method section because you don't have enough space to do that. Just use references and mention some studies where these standard methods have been fully described. For example, some cardiac surgeons use an operation called Ross operation for some of their patients, and this Ross operation is actually a standard method about which many articles are available in the literature. So if you are, for example, a cardiac surgeon and you are going to use this Ross operation technique, you just need to give some references for this Ross operation, and you don't need to describe everything about this approach in detail. Maybe only 2 or 3 sentences saying that you use this operation technique, and very briefly the approach is something like this, and this is the reference that readers can refer to read about the standard procedure. So again, as you can see in this example about ethics approval in a published article, this study was approved by the University of British Columbia Clinical Research Ethics Board, and the authors wrote and exactly mentioned the Research Ethics Board approval in their method section. Method section is the section of your article where you need to mention about the exact drug dosages that you used for your patients. And while you are writing about the exact drug dosage, you need to write about the manufacturer and the country where that manufacturer is located, as well as the route of administration. Also, you need to talk about the outcome measures or those parameters that were measured in the study. So in this study, which was published in the Canadian Medical Association journals, the authors explained that they randomized patients to receiving this remdesivir drug, 200 milligram intravenously, which is route of administration, on day 0, followed by 100 milligram IV daily. So the exact dosage of the drug is mentioned here, and route of administration, and the outcome measures were mentioned here. The primary outcome was in-hospital mortality. The secondary outcome were clinical severity and oxygen and ventilator-free days. So exact drug dosage, route of administration, outcome measures, and anything that our audience need to know about your medication approach to the patients. Sometimes while we are writing the method section of our article, for example, we need to use a questionnaire for gathering information about the patients, or there are some detailed methodology about what we did. In these situations, you don't need to write everything about this questionnaire and publish all the questions of, for example, this questionnaire in the method section of your article. You just need to refer the readers to the web version of your article that is published on the website of the journal. And also you can use extra information about your methodology in the supplementary files that you can attach to your article when you submit your article to the related journal. Method section is actually the place that you need to talk about the statistical analysis, the software that you used for a statistical analysis, and the version of that software. So any statistical test that you have used for analyzing your data should be mentioned in the method section. But at the same time, please be very careful that it's a temptation for some junior researchers to write some names of sophisticated statistical tests in the method section to show that they have done a very sophisticated analysis. Please be careful that later on, when you are going to write the results section of your article, you need to mention how you exactly use those statistical tests, and peer reviewers can catch these issues in your article. So again, another example from a published article where the statistical software, SPSS software version 23, was mentioned, and also it is mentioned that a more detailed description of the statistical analysis is provided in the appendix 2 of the article. So finally, the different paragraphs of your method section may include the study design and the inclusion and exclusion criteria of your study, the materials that were used in your study, the participants who participated in your study, setting of your study, and also ethical issues that you considered while you performed your study. The next paragraph can be devoted to the intervention that you did or exposure that you did, and the other paragraph will be devoted to the outcome measures or parameters that you measured during the study, and the final paragraph is a paragraph which is devoted to a statistical analysis and other related issues that I mentioned earlier. Please don't forget to read related guidelines for better reporting of the method section of different types of study. You know that original articles may have different designs. For example, we have RCTs, which are published as an original article, systematic reviews, which can be published as a research article or original articles in some journals. In some journals, they are not. Or observational studies are published as original articles. Um, the good news is that there are different guidelines available in the literature that you can use for better reporting of these types of studies. And I will prepare another video um, exactly devoted to different types of guidelines that you need to use when you are using different designs for your studies. For example, for reporting RCTs, consort guideline is a good guideline telling you what exactly peer reviewers will ask you when from different parts of your articles, specifically in the method section. Or when you are writing a systematic review, Prisma guideline is a very good guideline for better reporting of systematic reviews. STROB is another good guideline for reporting observational studies. So when you are writing your article, in addition to the general considerations that you need to consider, while you are writing the method section, there are specific considerations that you need to be careful about when you are writing about different designs of your study. And as I mentioned, in future videos, I will talk about these different types of studies when I finish talking about how to write your result section and how to write your discussion. And in that video, I will talk about different guidelines and how you can use those guidelines. So please keep in touch and follow up our videos at the IMR Press. And we try to give you the most up-to-date information about the standards of medical writing. Thank you very much for your time.